So the last one, which is very dear to me, as a patient, as a parent, which is patient portal. We have to start giving information to the patients. We need to engage the patients so they can drive the bureaucracy of healthcare down in the US. So one of the things that I did, our patients at Duke can actually schedule their own appointment, and they can cancel it, and they can decide which primary care they want to see, and they have access to all their medical reports. They can look at their medication data, they can look at their allergies, they can take a one-page printout of it with them when they go on vacation, and they can pay bills online, which my CFO really likes, and they do pay quite a bit. I'll show you that in a minute. And so right now, almost 40% of all our established patients are online. We didn't market it. All we did was put a poster in every clinic. Because the nurses and the doctors in the clinics found the utility and the patients loved it, it just grew on its own. This was an organic growth. We designed the system intuitive with patients who actually helped us design. We had patients on our design team who said, and I designed it as a CIO, as a patient, because I said, my children who are minor, I should have access to their account through single log-on. So your minor children are mapped to the parent who is the insurer. So you don't have to go into 3 different logins, as you know how painful that gets. So it's very active. I'm just giving you 1 year of data on this. And what's beautiful about it is the patients are actively looking at the lab results and radiology reports. And I have some really heartwarming stories. We have 3 stories in which you can imagine even 6 sigma, when you have 1 million of results, there will be 1 person who may fall through the crack. And I don't want to be me or my family. So when you have a system like this, if that 1 person gets the report, in case the patient's doctor forgot to notify them and it was abnormal, we had 2 cases in which early stage prostate cancer got notified because we have a little bit moratorium because we want the doctor to tell the patient if the results is abnormal. But if they don't, 10 days later, the results go onto the portal. Patient can see it themselves. We give them 10 days to be able to, but so we had 3 cases, as I said already, in which early stage detection of breast cancer as well as prostate cancer were actually first detected by the patient who said, you know, this report says abnormal, and called the doctor's office. Not mad, actually saying thanks that the system worked, that that you forgot to notify me. Not that there's any excuse for that, but at least there was a safety net in place. And that's what I mean by patient engagement. Why leave the patient out when in the end they are the ones who have to live or die from it? They have to be active participants. And this is the future we are in the process of rolling out. So here's Amelia Earhart. Well, we know she vanished somewhere over Pacific, but that's a different story. But that's our test patient. You can see you can manage your appointments at Duke. You can manage your medications. You can look at your vitals. You have dedicated problem-based educational information dedicated to you for your illnesses coming to you. You have your health maintenance, whatever you're interested in as a patient, and your most recent results. Simple 1-page dashboard. They can print out, they can query, easy as that. No need to say, we can't do it. So I really believe in US, I think clinical value of IT, if it's on vertical axis, we're still stuck at the bottom left. People still don't know where it's in. Is it EMRs? I don't think so. It really is about applying health analytics to the data that we already have. We already have so much data that we don't use. Yes, EMRs are good, but we shouldn't apply them till we understand the full process. We shouldn't simulate till we understand the full design. We shouldn't simulate silos. They will crash. So the notion is, I think with meaningful use, I think while EMR-based adoptions are good, but where we need to go is here. We need to go towards business intelligence and decision support that's action-oriented. Why we need to do it? Because if you look at all these ads with 23andMe and all these things and all these genomic and genetic-based tests are going, we soon will be pushed to the limit if we don't design our systems, because that's where we need to go in not too far distant future. It's already happening in diseases like oncology, and we can't even get people's blood pressures properly quantified.